Hello viewers, welcome to URON, and we are organizing Urologist on Air, where we are generating conversation with very eminent doctors of India. So today we have one more very eminent doctor and urologist. So sir, before starting anything, I'd like you to introduce yourself to the viewers.
Yeah, I am Dr. Anil Takwan. I am practicing in Ahmedabad, Gujarat, and I am mainly practicing on the pediatric urology. Pediatric urology means we are taking care of a patients group which is up to 15 to 16 years of age. So it's a very important group of patients.
Sir, I'd like to add a question. Overactive bladder, but most of the people think that this problem is only seen in aged patients who are above 40 or 50. But I want to ask whether this problem is whether this problem can be seen in the children which are aged between 10, 15 or 20.
So it's a great question,
Yeah.
and the children do have a leak, and for that there are so many reasons are there.
Yeah.
One is the overactive bladder, means bladder ज़्यादा काम करती है जरूरत से, उसको ओवरएक्टिव ब्लडर बोलते हैं. That is one of the reason. There and other reasons are by birth there is some defects, then also child can leak, and another thing is the child can leak in the night, which is a completely separate topic but very common thing, common area where it is known as anuresis.
Okay, sir. So, can this problem be seen only in the day times or in the night time or in both the times in children?
So night time is anuresis, and it's the almost 80% of the children they get urinary control for the night time by the age of 2 years. After 2 years, हर 2 साल पे 2% patient these बच्चे उसमें ऐड होते जा रहे हैं. तो by 7 years, most of the time these in most cases 90% they get the nighttime control. But by nighttime control is not there, and they are leaking urine into the bed by the age of 6 or 7 years, then you have to visit your pediatricians, your urologist, and ask for the help. And it can be simply treated with some lifestyle modifications of children as well as parents, as well as by medications. And for the daytime leak, it is a kind of a bit serious. There you have to go for some simple test for urine, blood examinations and sonography to start with, and with that you can get the diagnosis and then subsequent help from the urologist.
Sir, you were talking about lifestyle modifications. What lifestyle modifications would you suggest to the patients who are above 16?
Yeah, perfect.
Below 16?
So the many times we make habit in the children to consume some cold drinks, hot drinks into the late evening, right? They go on seeing the TVs or mobiles, and with that they consume these cold drinks and soft drinks and all those things. That need to be stopped. One. Second thing, they have to make a very habit to sleep in a proper time. And third thing is that they have to evacuate the bladder before they go for a sleep. And fourth thing is that overall they have to not consume too much of water. So all these things, if it can modify, then it can help child less leaking into the night. And then if the problem is still not solved, we can add the alarm. That is a little bit of wetting of cloth, and the alarm will buzz, and that way it can be treated, as well as we can add some medications. But there should not be social stigma, because child need to be dry. Then and then they can go to the vacations, they can go to the tour, they can go to the relatives, they can go to the friends, and otherwise their progress will stop. Progress will be in a problem. So this thing can be addressed with a simple kind of things.